Hello, my name is Taylor. As I have prepped myself through SVU's BSN program, I have developed many principles of the liberal arts program that I will implement in the nursing care I provide. One area that is essential when providing safe, quality patient care is communication. I have continued to use technology skills developed to effectively communicate with physicians, pharmacists, therapy services, and other colleagues when providing a collaborative approach to nursing care. Another aspect to nursing care is understanding the culture and beliefs of other individuals. Do you have to become an expert in the different religious and cultural beliefs? Of course not. But as a nurse, we must be aware that there are several differences, and patients may stray away from the developed plan of care, and they have the right to do so. The last principle that I will continue to implement is using my knowledge and learned skills while developing decisions for my patients. I understand that nursing is based on evidence-based practice, and there may be a variety of different plans of care in reaching desired outcomes. In regard to the first essential liberal education, a value of lifelong learning to strive for excellence in the nursing practice is also expected. Nursing is surrounded by evidence-based practices that are continually changing as new research is discovered and patient population evolves. For those who work in the acute hospital setting, we understand how sick some patients can be. Unfortunately, patients are going to continue to become more sick. Therefore, once research is developed and hospital facilities begin to practice these new developments, we as nurses must evolve as well. One way I personally will commit myself to lifelong learning is to understand the why behind these new expected practices. It is easy to become familiar with the ways we were originally taught as new nurses. And yes, it is hard to break habits that we don't see as harmful or life-threatening. However, if the new development have an explanation as to how or why these new implementations of nursing care will improve patient outcomes, it may be easier to follow these regulations. Another way I will continue to expand my knowledge and skills as a nurse is learning from my colleagues, whether that is a physician, nurse practitioner, respiratory or physical therapist, or newly graduated nurse. We may not always have the time to round with our physicians, but I find myself learning much more as they explain certain diagnoses and plans of care with the patient. While providing a collaborative approach to nursing care, it is essential to work with respiratory and physical therapists and follow their recommendations as they are better trained in each of those areas. Respiratory therapists have at many times provided a better explanation to me when using different nasal cannulas, masks, and reading arterial blood gases. As mentioned before, nursing care is continually changing. Therefore, it is valuable to understand a newly graduated nurse's way he or she practices skills. Nurses act as servant leaders as they strive for excellence in providing patient care by attending to the needs of patients, their loved ones, peers, and the nurse themselves. Of course, patients' health and safety are our main concern as our day goes by. As one of the main advocates for our patient, the nurse is expected to foresee patient outcomes if and when the patient begins to deteriorate. The nurse must act in a timely, appropriate manner to prevent the patient from harm or even fatality. This includes following hospital protocols in an emergent situation, such as if a patient becomes unresponsive, in respiratory distress, or if the patient is suspected for sepsis or stroke. Nurses also seek to understand the needs of patients and empathize with them, whether the situation be minute or life-changing. It is also important for the nurse to understand that he or she is not only serving the patient, but their family member as well. It is normal for the family member to become protective of the patient and ensure their loved one is receiving the care they need. Nurses must be the listener to these family members and either act as an advocate to make sure the patient's needs are met, or to provide the family an appropriate explanation to their loved one's care. In regards to the end of life, it is essential to provide empathy and spiritual care to the family. After a patient has passed away, we allow the family the time they need to cope. This includes being there for emotional support if needed. As nurses, we also can alert a chaplain to provide the family member with spiritual care and healing. Another important aspect I have learned throughout my 2-year career is offering the patient and family member outcomes of situations, whether they are good or bad. As a healthcare professional, we understand the human body and disease processes better than others. Therefore, a servant leader should offer an explanation for each decision, rather than persuading them to make the decision the nurse feels is best. Another way to act as a successful leader is to serve our peers and coworkers, which is also very close to my heart. Our peers include each nurse, aide, secretary, manager, supervisor, and clinical educator for each floor and department. Stewardship is a significant characteristic to implement as a nurse. I have seen where others have stated, "That isn't my patient," when being alerted on their status or needs. However, as a healthcare professional, if any patient is in dire need of medical assistance, it shouldn't matter if the nurse alerted is the primary nurse or just another nurse working on the floor. Nurses should be obligated to help others in need, whether that be a patient, family member, or coworker. As we know, some shifts are extremely worse than others. As a servant leader, the nurse should be aware of other coworkers' struggles and strive to help them succeed. As nurses begin to expand their knowledge and improve nursing skills, they may be asked to become a preceptor for new nurses. A servant leader is committed to maximizing the strengths of other coworkers. I also believe it is extremely important for the entire floor to build a relationship together. I am very thankful to have started my career on a floor that has shown the importance of acting as a family and building a community. We strive for excellence together, cry together, celebrate together, help each other, and encourage each other to be the best nurse we have the ability to be. However, acting as a servant leader to patients, their family members, and coworkers would not be attainable without self-awareness. It is essential to know one's own strengths and weaknesses. As a newer nurse, I understand that I have much more learning to obtain throughout my career. Therefore, when patients begin to deteriorate, I quickly alert my charge nurse or other experienced nurses. I also feel very comfortable in asking for guidance when performing a new skill or administering an unfamiliar medication. However, I also have developed many strengths, such as educating my patients on diagnosis, medications, plans of care, and lifestyle changes. I have recently began precepting students and new nurses as well, which is very self-rewarding knowing I have the ability to guide these individuals through the orientation of nursing care. As I have continued with the bachelor courses at SBU, I have been able to develop more as a spiritual nurse. Not only is nursing care based on medical treatment, but it is also based on the patient's well-being, including mental and social factors, otherwise known as holistic care. While developing the patient's plan of care, this includes healing their medical needs. However, we must also acknowledge the patient's mental status. Is the patient's cognitive ability deteriorating and they are unsafe to care for themselves at home? Is the patient a harm to his or herself or others? Has the patient been abused at their previous care facility? Based on these answers, the patient may need assistance in finding a safe discharge from the acute setting. As Springfield continues to become a much larger city, we also come in contact with several different cultures. The bachelor courses at SBU have guided me in providing holistic care to those who may not speak the same language or have the same beliefs as I do. Some beliefs that individuals have may at first sound obscure, but I now have the ability to better understand other cultural beliefs through research and become more sensitive to these individuals. Thank you for taking the time to watch and listen to my spiritual and liberal arts assignment.